Hello and welcome to this month's Wellness Moment on women's health. Today we're going to be talking about women's health and the leading causes of death for women. Our goal is that this would help bring awareness to health issues related specifically to women and encourage all women to be as healthy as possible. And men, we'll be talking about you in June's Wellness Moment. So celebrate the women in your life during National Women's Health Week from May 9th through May 15th. Women commonly take on the caregiver roles in families and carry the burden of taking care of others while still working. And this is especially true since COVID started, as women have had to take on an additional role of helping their kids learn at home, while often also having to work. This doesn't exclude men, but often this does fall on women. As a caregiver, in some cases, women may not prioritize their own physical and mental health. National Women's Health Week encourages all women to make their health a priority and get the care that they need. The top leading causes of death for all females in the United States are heart disease, cancer, chronic lower respiratory disease, and strokes. More than half of all women are not aware that heart disease is the leading cause of death in women. Heart disease includes various conditions such as coronary artery disease and heart attacks. 1 in 16 women 20 and older have coronary heart disease. Risk factors for heart disease include diabetes, being overweight or obese, being at an unhealthy weight, being physically inactive, and drinking too much alcohol. In addition, symptoms of heart attacks for women may also vary from those of men. There are things that you can do to reduce your risk for heart disease, including knowing your numbers for your blood pressure, your cholesterol, including your LDL cholesterol, total cholesterol, your triglycerides, and your HDL cholesterol, and knowing what your blood sugar is, so your fasting blood sugar level and your hemoglobin A1C, which is a measurement of the last 3 months. Quit smoking if you've been smoking. Learn to manage your stress better. Limit the amount of alcohol you consume. Eat a healthy diet. Get exercise, and maintain a healthy weight. Cancer is the second leading cause of death in females in the United States. And the most common types of cancer in women include skin, breast, lung, colorectal, and uterine cancers. To prevent cancer, stay up to date on your screenings and preventative exams. Do not use tobacco products. Limit the amount of alcohol you consume. Use sun protection when you're outside. Get regular physical activity, eat a healthy diet, and maintain a healthy weight. Genetics can also be a factor for certain types of cancer, such as breast cancer or ovarian cancer, and uterine or colorectal cancer. So knowing your family history and discussing it with your healthcare provider can help you stay up to date on your preventative screenings and make sure that even if you are diagnosed, you can catch it sooner and have better outcomes. Other health topics for women include anxiety, birth control, caregiver stress, eating disorders, disordered eatings, iron deficiency, anemia, and lupus. There is a whole list of topics on women's health at womenshealth.gov, and this link gives a list of A to Z topics of women's health. So these are a lot of different health topics related to women, from acne and anorexia nervosa, binge eating disorder, birth control methods, caregiver stress, and different things like domestic violence and abuse. There's a lot of different topics on these, and there's one on polycystic ovarian syndrome too, which is a common one for women. And each of these different topics has a lot of information on just symptoms, what these conditions are, and different treatment options, as well as how it pertains specifically to women. So if you have any questions, this is a really great resource to go to and look through. If you have additional questions about women's health, make an appointment with your Everside clinician to discuss what you can do to be the healthiest version of yourself. And men, don't worry, we'll talk about what you can do next month. Here is our address and our hours of operation, and to schedule an appointment, please call 866-959-9355. And if you have any additional questions, please feel free to contact me at sarah.wiseman@health.inc.com.